Good afternoon, good evening, good morning, and welcome to episode 81. My name's Richard, I'm a registered nurse. My clinic's in the UK, it's called No More Earwax. Strap yourselves in. Bit of a long one this, but I think you're going to enjoy it, especially the one after this one. For those fans of a bit of appeal, you're going to really enjoy this. As frustrating as it was for me, I think you'll enjoy watching me suffer. So this lady, lovely lady, come to see me with her daughter. Hello if you're watching, by the way, if you've managed to find the channel. And her ear canal was complete. This was a right one. It's completely occluded by this, almost like a perfect mould of the ear canal, kind of like a cocoon. Anyone remember that film, Cocoon? That was a good film. Takes me back. Showed me age there. So I suspect what's happened is the skin in the ear canal, it sheds as we know, and then you get new skin. But what's happened is this has shedded, and then it's not left. It just kind of stayed there. Now you can just kind of see to the edge of that. You might well be able to see a little glimpse of the eardrum in the distance, or just underneath it. I suspect this may well go all the way down to the eardrum. She's been having terrible trouble with tinnitus for quite a long time. It was actually looked at this by some of the healthcare professionals, but they didn't feel they could do it. Which is fair enough, you know. If you're not confident you can do something like that, then great. But I'm glad she found me. But the first bit, as you just saw, just broke away there. And these are beyond frustrating. All these ones. Whilst the fine end is great for this stuff, just doesn't come with the same suction power as the other tube. But with the other tube, it would have made a horrible squeaky noise when you're trying to pull something like this. So I'm having a bit of a wrestle with it there. And I'm wriggling it up and down. And the purpose of that is to try and unstick it, because whilst this bit's loose, further down the ear, it's probably still stuck to the sides, or even the eardrum. So trying to manipulate it like that, up and down and round, hoping that it unsticks, so we can pull it out. But proving a little battle this. It's been well oiled, because you can see it was very shimmery and moist. A lot of people don't like that word moist. I don't know what it is. Whenever I say, ooh, don't use that word, I don't know why. Perhaps somebody can tell me. So what I'm trying to do there is grab it from the bottom there and lift it up, and literally trying to lift it off the ear canal lower down where it's probably stuck. Now I'm going to persevere with this for a while, because I'm a little bit stubborn for a start, and I suspect that if I try and grab this with a forceps, it might well just cut through it. But you'll see in a bit that it turns out I was wrong anyway. But it's a good idea to give it a good wriggle like this, even though I could probably grab it at this point, giving it a good wriggle first to try and just, like I said, unstick it and separate it from the canal wall. And yeah, you'll enjoy it. This comes out. It is just like a perfect mould, a cocoon, so to speak, of the ear canal. And it's quite a thick layer as well, so you could barely hear anything at all with this in your ear. And I'm not surprised, really. But it's probably more to do with the fact that it probably coated the eardrum as well. But the second one you're going to enjoy. I certainly didn't, and you'll see why when we get to that point as well. It absolutely drove me mad. It was really frustrating. And it is slowly coming forward, but I think it just needs something else to get that out. So let's head for our toolkit and grab the trusty crocodile forceps. And I suspected that it might well just shed through it, but it didn't. Managed to get a decent grip of that. And look at the size of this when it comes out and what it looks like. So it's can't quite tell from there, but it's kind of hollow. There's nothing in the middle of that, because we flattened it out afterwards, and it was just like a shell, a perfect shell. And there's the eardrum. Like I said, I suspect that was a whole perfect layer that went all the way down to the eardrum and peeled it off there. She noticed a big difference straight away. Now this is the other one, and on first glance you're thinking, oh, it's just a few little bits stuck around the side here. As you can see, it's a lot drier. Stick with it. The images do get a bit better and a bit clearer, but they're a bit close to the hairs here, so it is a little blurry, but stick with it. It does get really good later on. But again, I suspect this is a perfect, because you can already see the eardrum in the distance there, can't you? But it turns out that I think there was a very, very fine layer of skin that was actually sitting on the eardrum. You'll see that as we progress. It did surprise me how difficult it was to remove, because, like I said, we need to stick with a fine end here for this kind of work, this kind of delicate work. So what you're trying to do is trying to grab it, pull it to the side, and let go, and then grab it again nearer to the wall of the ear canal, so then you can peel it away. But this is why these are so frustrating. As you try and let go, obviously some bits of it just still stay there, and also what happens is it wants to spring back towards the ear canal. So they're beyond frustrating. And I'm pretty sure that because this is a lot drier, I'm pretty sure that if I try and grab this with the forceps and give it a snip, it literally will do that. It'll just snip straight through it. I did try in a bit, just to prove to myself that I was right. It turns out I was right in that one. And again, a bit of oil possibly would have helped at this point, but there's a good reason why I didn't. I've explained it in another video. Because we're quite close to the outside of it, you've got all the hairs there. And you put the oil in there, no matter how much you try and wipe it away, it's forever getting, these hairs will be coated in the oil, so when you put the camera in there, it'll pick up some of that oil. It's almost impossible not to. And then the camera gets blurry. And then I get shouted at in the comments, why is it so blurry? But like I said before, I really don't care. Anybody puts any comment in there, it's like water off a duck's back. Me, I'm really not bothered. So do your worst. But as you can see, I'm trying to grab that with the forceps, and as you can see, it's so dry and crumbly, it just snapped off straight away. So I binned that off and thought, let's just try and carry on peeling again. Oh, you did, by the way, if you went and got yourself a brew, let's have a cheers. I've got mine as if by magic. Here comes mine. Cheers. T1 for me. Yorkshire tea. The only tea. Forget all the others. Yorkshire tea is the only one. Not a coffee drinker, can't stand the stuff. But if you're in the US, have a search up for Yorkshire tea. It's by far the best tea. I'll probably start some kind of argument in the UK. They'll start shouting at me in the comments, oh no it's not. But it is. Now, where I'm having trouble with this is I've managed to peel it away from the sides there, but it's kind of anchored down at the bottom, at the base of the ear canal here. But what happened was, every time I went to try and grab that bit from the bottom to pull it up, the lady coughed. And I've edited quite a lot of that out. It was just this bit here, because it must have happened about 5 or 6 times just as I tried to pull that up. Now, it can do that sometimes, it can trigger a cough. So I had to be really careful to try and pull that as gently as I could. But no matter what I did, every time there you go, that's why I just stopped just then. Like I said, it just triggered this cough. But we're managing to get someone that's finally peeling down that side, down that edge there. And the further and further I get here, the more I realise that this could possibly be the cause of why she's been having trouble in this ear as well. Particularly with tinnitus anyway. That's what we hope anyway, because I don't think she's heard clearly in this ear for a long time. And I think it made a big difference. So again, I've managed to separate that from the side. So I'll just have another go, just with the forceps, and I've got a really good grip there, and I'm pulling so slowly and giving it a very gentle wiggle. But you can guess what's going to happen, can't you? That's right, snapped off. It's just too brittle. It's really, really difficult. So what I've done, you can probably spot already, I have put some oil in because we're a bit deeper in the ear. So as long as I get past those hairs without getting any oil on the camera, we can see a lot better. And the visuals are pretty good. It does get a little blurry from time to time, but nothing that we can't cope with. So how this helps here, it does help get a slightly better grip on this skin. But mostly what it'll do, you can see it shimmering down the side of that, can't you? When you pull it a little bit of the oil will then dribble further down, and help to just unstick it. So every time you peel it, a little bit of oil goes a bit further down the ear canal, and helps to just unstick it and peel it away from the side. But still, it's frustrating. Can't begin to tell you how frustrating it is. And I think it might be just at this point where you can actually see it coming off the drum. So those eagle-eyed viewers, you might be just spotting to the top edge. You might see it just separating away at the very far end of the ear canal, and you can actually see the eardrum just flinch slightly. Not too much that I thought we should stop, but there you go. I think she did actually flinch a little bit then. That's why I just came out for a second. Again, I think it was the cough. It didn't actually hurt. None of this procedure hurt in any way at all. But I think she just had a little cough again there. That's why we had to stop suddenly again. So yeah, just trying to, again, just watch it, just on the edge there. Like I said, go a little blurry, but it's still clear enough that you can see it. Trying to pull it away from the eardrum, because I suspect there is a really, really thin layer of dead skin that's not migrated off the eardrum as it should. Hope you've enjoyed this epic so far anyway. I can't say I enjoyed doing it. It was a flipping nightmare, but she was very patient, really patient. Right, one more go. I think this might be the money shot. And again, you think the eardrum looks fine until you actually start to see it. There you go. There you go. Did you just see that then? And it is stuck to the drum. You can see the oil, can't you? Just nestling on the side of that skin sheet. Maybe it's this one. There you go. You can just see a very fine edges of this skin. There we go. Look at that. How satisfying is that? I think these are amongst some of the most popular ones that we do. I've not had one like this in for a while, but as soon as I saw this, I thought, "Ooh, this one's a good. You're all going to enjoy this." But yeah, they're not fun to do. They're just so frustrating. And again, this bit is quite deep in the ear, so I probably wouldn't think of going this deep with the forceps. But it was going away. And look at how thin and fragile this is. It's almost translucent. And I'm sure, as eggs is eggs, that especially the translucent part of this was actually covering the eardrum. There you go. Beautifully shiny, clear eardrum. It's a little scar. I mean, this lady was of an age, should we say? And there it is, what's come out. So yeah, the one in the middle was, I think, what came off the eardrum in the left ear. The other one was the cocoon that had come out of the right ear. So I hope you enjoyed that. If you did, then just let me know. Send us a comment, click a like, click a follow, click a heart, whichever platform you're watching it on. I'd love some new subscribers or followers on any of my channels. Those go down a treat. But for now, take care of yourselves, and I'll see you soon. Bye-bye.